Hello everyone. We are discuss about lumpy skin disease (LSD). LSD होता क्या है? इसका इलाज lumpy skin disease, sign, symptom, treatment and control. Lumpy skin disease is an acute disease of cattle characterized by fever, cutaneous nodules, and generalized lymphadentis. It has synonyms: Neethling virus diseases, pseudo-urticaria exanthema nodularis bovis, noveliste, and etiology. LSD is caused by Capripox virus, Neethling virus, related to arthropod bone pox virus of sheep and goats. It highly resistant, large virus about 230 to 300 nanometer. It has one serotype, an LSDV cross reaction with other Capripox viruses, and epidemiology. The first reported in Zambia 1929, Botswana 1943, South Africa 1944. Periodic epidemic in African countries. Israel 1989, since 2020, 12, spreading from Middle East to Southeast Europe, affecting in 2015 Greece, Bulgaria, Serbia, Kosovo, Albania, and Montenegro. Morbidity rate is 5 to 45% and mortality rate is 1 to 5%. It is mostly affect the cattle, all breed and age susceptibility. Incubation period at 2 to 15 days. Viremia usually less than 2 weeks. Virus in skin nodules persist about 33 days or longer. And transmission. LSDV is transmitted by arthropod vectors like mosquito biting fleas, male ticks, and mosquito culex aedes, biting flea stomoxis, and biomia, and male ticks like Trichicephalus ambyloma. Sign and symptom. Mostly sign is the cutaneous nodule about 2 to 5 centimeter in diameter, develop particularly in the head, neck, limbs, udder, genitalia, and perineum within the 48 hours of onset of febrile reaction. Seed fast and mostly sign marked a reduction in milk head in lactating cattle, enlarged superficial lymph nodes, vesical erosion, ulcer may be developed in mucous membrane of mouth and alimentary tract and the trachea and lungs. Limbs and other ventral part of body is that develop brisket, scrotum, vulva may be edematous and that reluctant to move. Wool may be permanently or temporarily infertile if the infected cattle is pregnant and the cow may be abort. And also lacrimation, increased nasal pharyngeal secretion, anorexia, dysalactia, general depression, and disinclination to move. Fever may be exceed 41 centigrade. And diagnosis. Field presumptive diagnosis of LSD like morbidity, mortality, and clinical sign of that reflect the LSD. Histopathological features and confirmatory diagnosis of LSD can be based on the isolation of virus. Confirmatory diagnosis based on the TEM, transmission electron microscope, immunoperoxidase, staining, antigen trapping, enzyme linked immunosorbent assay, ELISA, and polymerase chain reaction PCR test. Treatment. No specific treatment. Symptomatic treatment. Antibiotic, anti-inflammatory drugs, short vitamins. Use some treat to secondary bacterial infection or to deal with the fever, inflammation, and improvement of the animal appetites. Prevention and control. Insecticides together with repellents. LSD outbreak can be indicated by quarantines, depopulation of the infected and exposed animals, proper disposal of carcasses, cleaning and disinfection of the premises, and insect control. And vaccination like Capripox vaccine and vaccinate immunoglobulin prophylaxis like homologous live attenuated virus vaccine and heterologous live attenuated virus vaccine. Thank you everyone